Growing up, I always knew I would be in medicine. At first, I entertained the idea of becoming a nurse. Then I entertained the idea of becoming a physician. However, what kept me from wanting to become a doctor were the years of education and the years of residency post-education. So I wanted something in between. She's doing great. Her drainage is minimal, about 5 cc's, and her recovery seems to be going right on track. This is the plastic surgeon's office. We have 1 plastic surgeon. I'm the only physician assistant. We have 2 nurses, 1 surgical assistant, and 1 laser technician. In this practice, I do the consultations with or without the doctor, pre- and post-operative care, Botox, injectable fillers, for example, collagen, Restylane, HA, things like that. I also assist in laser procedures, in all surgical procedures. Expectations.
Okay.
For example, a lot of women come in thinking that they're going to leave looking absolutely radiant the day after surgery, and that it's just not realistic. I normally assist Dr. Friedman in the consultations, or if he's in surgery, I'll do them alone. And with the patient's help, we come to what's the best option for them after weighing the pros and cons of everything, from cost to recovery to realistic expectations. Give me a call and we can set this up whenever you'd like. Being a physician assistant allows me to see my own patients, treat, diagnose, write my own prescriptions, care for patients, advise them. Any little nick that you make can potentially leave a scar, so you just want to be careful. However, it allows me to also be at home at 5 o'clock to take the kids out somewhere. It depends. Like I said, because we're right in the middle of summer, it's hard to tell. But things that I cannot do that only the doctor does is surgery. I do not perform surgeries alone. Dr. Friedman does all of the cosmetic and reconstructive surgeries. However, I can assist in them. I could do suture removals, and I can do minor mole removals and things like that on my own. For example, the woman we saw earlier today was 1 week after a facelift, and we removed the stitches from behind her ears, who was doing great. But I wanted to talk to you about the intense pulse light procedure that we're doing today. The IPL, or the intense pulse light treatment, is another procedure that I do here in the office. I'm going to put a thin layer of ultrasound jelly onto your skin. That procedure is to help improve redness, rosacea, and also to help even out some of the pigmentation from sun damage. You're doing great. One of the other things I do here in the office is post-operative care. Earlier today, we saw a woman who was about 6 weeks status post full face laser resurfacing.
Said to do this.
Yes. And what you're doing is pushing that fluid back.
Yes.
And increasing your circulation. And I went over her skincare regimen, answered any questions, and addressed all the concerns that she had for her recovery period. It is fresh, tender skin. This is like baby skin.
It is.
Most programs nowadays are master's degree, where you would have to obtain a bachelor's degree in biology, kinesiology, a bachelor of your choice. However, certain prerequisites have to be done. Organic chemistry, medical terminology, certain classes have to be taken prior to even applying to the PA program.
Okay. And I think just a little bit of...
I get to practice medicine, I have autonomy, yet I get to go home with a regular fit schedule 9 to 5, and I don't take calls on weekends. It's a great schedule for me. The only reason I would go back to medical school would be if I were bored of this, and I'm not. One thing that's very different with a physician assistant compared to a nurse practitioner is that when you become a nurse practitioner, you decide what subspecialty you're going to go into. For example, pediatrics, where you only do pediatrics, geriatrics, family medicine, OBGYN. Once you graduate with that nurse practitioner in OBGYN, you're not allowed to practice anything outside of that. However, with a physician assistant, yes, it's a 2.5-year program, but in that last year of residency, we do rotations in every subspecialty, from OBGYN, pediatrics, surgery, trauma, general medicine, versus today I'm doing plastic surgery. If I decided I was bored of this, tomorrow I could turn and go into pediatrics. So this allows me to have complete flexibility and keeps all of my options open. That's why we have to pass a national board exam in every subspecialty. Every 6 years, I believe we're the only field that has to recertify. With so many patients being internet savvy, they come in talking in medical terminology. They come in saying things like, I have erythema on my left lateral cheek. I have swelling. Well, people don't say swelling nowadays. They say, I have edema. And if you don't take medical terminology, you wouldn't know what edema means, erythema, postoperative, preoperative, status post, hemorrhaging. Just about everything, our everyday language is medical terminology. We see a lot of ethical and non-ethical situations that we come across. For example, about a week ago we had a woman who came in who was obviously addicted to plastic surgery. She was 38, wanted a facelift, and didn't need a facelift. And I met with her and I said, ma'am, you're not a very good candidate for this procedure because you look great. You don't have very much skin that we can pull back. You would end up looking plastic. And she, I believe, was traumatized maybe verbally by her husband saying that she wasn't attractive, and maybe that's what encouraged her to come in here. And after I told her that, she got very upset, and that's when I had to call on my supervising physician to come in and talk to the patient, and he agreed with what I had told the patient, and unfortunately she left here upset. However, this is a very ethical practice. We only do things that we think are